Hello and welcome to ThePrint. I am Sumi Sukanya Datta and you are watching Health and You. It's that time of the year again when temperatures are soaring and the heat is oppressive. Many people are falling sick because of this heat. So what can we do to protect ourselves? How exactly does heat does harm to our health? To discuss everything around how do we protect ourselves during these extreme temperatures, we have with us Dr. Neeraj Nishchal and Dr. Amlendu Yadav. Dr. Yadav is head of emergency medicine at RML Hospital in Delhi. Dr. Neeraj is additional professor in the Department of Medicine at the All India Institute of Medical Sciences. Thank you so much, Dr. Yadav and Dr. Nishchal, for joining us in the conversation today. First of all, Dr. Neeraj, could you help us understand what kind of problems can heat lead to? Also, a very practical question. How do we exactly identify the sign of heat exhaustion or heat stroke?
See, heat related injuries, they have a spectrum. It's not that suddenly somebody will have heat stroke. Usually, there is always a warning. So, there
Mhm.
will be mild symptoms. The initial part of heat related illness usually could be simply sunburn. If you are a fair skinned person, especially you step out in sun, you all have must have experienced this type of heat.
Yeah.
And then after that, if you are not acquainted with the working in heat or something, then of course the chances of the earliest heat related illness could be simply dehydration. That means your body is losing water and salt, and that can cause weakness type of feeling, lethargy, if you are standing you might faint. That's a body mechanism of maintaining blood pressure. Then if you don't you continue working in that particular heat, then you will develop cramps. That is basically muscles getting fatigued because of loss of mostly potassium sodium from the body. And of course, if sodium is lost, then potassium equilibrium will also be affected, so you will develop cramps. And if you don't heed to that, you continue working, then in extreme cases, when the heat loss from the body is not properly compensated, then the core temperatures start rising, and then the serious spectrum like heat stroke can happen. So when we say heat stroke, that means the body core temperature is usually more than 104, leading to affect in the central nervous system, where patient may become delirious, lose consciousness, may throw fits, and if left untreated, other organs start getting affected. So, heat-related illness basically is a spectrum from mild heat burn, prickly heats to serious conditions like heat exhaustion and heat stroke.
Okay. Dr. Yadav, at RML, the first of its kind heat clinic in a government hospital was started last year. And
Yes.
last year, particularly, the scene was very, very bad because I personally went there and saw some of it. Many patients had come, large number of patients had been admitted. Many of them, unfortunately, also succumbed to heat-related extreme strokes. What was your experience of, starting this clinic, also dealing with patients in the clinic?
First of all, thank you for the invitation. And with these kind of things, basically, we are uh, creating awareness about the heat related issues and heat related illnesses. Climate change is something which is happening for the last so many decades. And
Mhm.
now we are actually feeling the heat of climate change. And last year it was so much of heat that in last year itself we received a classic cases of heat stroke, approximately 65 to 70 cases. Last year itself we received a classic case of heat stroke, and we were able to manage 65 of them. And and most of these patients who were heat stroke cases were actually came in unconscious state, in a hemodynamically unstable condition where blood pressure was low. Many of them were having CNS symptoms. By definition, most of them have the CNS symptoms. By definition, they lose their ability to sweat, and this is the reason they don't have any control of managing their own body temperature, and because of which the temperature keeps rising. And we have recorded a temperature of 110 degree in one heat stroke patients. Regarding the mortality, if the patient don't get the immediate treatment, the mortality is as high as 80 to 90%. But with the timely management and initiation of treatment, this mortality can reduce to just 10%. Last year, we were able to manage that mortality, able to bring down the mortality to 20 to 30%. But there is a further scope, and this it is always said that prevention is better than cure, and prevention in this disease will come through awareness about how to diagnose the disease, how we can prevent it, what precautions we should take. So these are the things which where the media can have a lot of bigger role to play, and creating awareness among the general public, among the medical professionals also, because this is something new which they have to attend to, which they have to keep in differentials. Like not all elevated temperatures are fever, it might be just a simple case of heat stroke.
Yeah, yeah, very insightful details there. Dr. Nishal, tell me something. You describe the spectrum of heat disorders. In some cases, it can be mild, moderate, and then severe. But when do we identify? When can people, who are suffering because of heat-related issues, or their family members identify this is now a serious case, and this actually needs an immediate medical intervention and should be taken to hospital? What is that point, and how do we do it on a practical basis?
So again, identifying symptoms, because the symptoms which these patients have, they can be in many other illnesses as well. So one can easily ignore if not aware about, okay, what's the situation. So these symptoms, like I said, though initial symptoms, prickly heats, which is you will feel irritability in the skin, which will resolve once you apply some powder, talcum powder type of thing, or you can apply ice, and these simple steps can help. But the danger sign starts when somebody is sweating profusely, especially vulnerable population. Vulnerable population, I mean, say kids, the elderly population of your house, or those who have comorbidities, especially those who are hypertensive, who are on a drug what we call as diuretic or beta blockers, which may affect the ability of diuretics anyway, causes water and electrolyte loss from the body, which is lost in all these type of heat related illnesses which we talk about: dehydration, cramps, or heat stroke. So these patients are very vulnerable. So if somebody is sweating very profusely, he has been working in a environment where the temperature is very high, and if humidity is also high, then that is again, even with low temperature, one can develop heat related illness. So the context in which the person has been basically situated, whether he has been working in a hot environment, hot and humid environment, or even the vulnerable population, if they are in hot and humid environment, they can develop these type of illness. So the symptoms may simply start as excessive sweating. Then the patient may complain of fatigue. The patient may complain of body ache, which is in the form of cramps, especially the lower limb muscle cramps. Or if we don't shift that person to a cooler temperature, then of course the spectrum will increase and the patient will complain of uh, fever. One can have fever. Then patient may have uh, loss in consciousness, what we call as sensorium. That is the severe form. And even if not attended to, then patient may develop what we call a seizure, and that is something which is very dangerous. So increased body temperature, profuse sweating, these are very I will say it's a warning sign that patient may have heat related illness which is progressing to severe illnesses. And if left untreated, multi-organ dysfunction may start. So patient will have anuria, that means the inability to pass urine. The patient is basically not forming any urine. Other
Okay.
organs like heart, that will be again strained because of all the pathophysiological changes that is happening because of prolonged rise in the body temperature as well as the ambient temperature. So warning sign, if you say this, it will start with excessive sweating, cramps, patient may feel nauseous, and if the patient start developing fever and altered sensorium, that is a very ominous sign that patient requires immediate management.
And in such cases, patients should be immediately taken to an emergency department of any
Yeah, the
hospital.
first thing would be to shift the patient from hot and humid condition to a relatively cooler place. That is something which does not require a trained medical professional. That is something which the awareness should be spread.
Mm-hmm.
If patient is conscious and oriented, of course you have to hydrate that patient. Whatever oral solution you can give, that is fine. But if somebody is in altered sensorium, don't try to basically hydrate them through mouth. They will require IV fluid. But for any person, layman, I will say, if not a medical professional, the first step is to remove that patient from hot and humid situation to a cooler place, and then immediately transfer to a nearest healthcare center.
Yeah, that's very, those are very useful tips that our viewers can benefit from. Dr. Yadav, since you, man an emergency department which sees a large influx of patients on a daily basis. So what we have been sort of seeing is during this season when the heat is extreme, not only those who have directly heat related illnesses, but also many other patients who uh, land up in hospitals. For example, we know for a fact there is scientific evidence to suggest that heart attack rates or strokes also typically go up during this season. So, what is your experience? And also, since you have been there for so many years, for decades, has a trend been changing? What exactly is your experience of seeing such cases in the emergency department?
Sumi, very good question. And based on my last year's experience, I can say definitely that the excess brought dead patients, which are brought during the heat stroke time, during the summer time, when the heat waves conditions are uh, prevailing, and when the temperature is crossing 40, 40, 45, above 45, uh, definitely there is 2 to 3 times more brought dead patients who are brought to emergency. This is based on last year's experience. And to sort of identify how much death is being contributed by uh, heat stroke during the summer vacation times, ministry is gathering a data based on daily basis. So they are recording data from each hospitals that how many cases are being brought as brought dead cases, and this number goes 2 to 3 times during the extreme weather conditions, extreme summer conditions.
Okay.
And this is one thing. And to identify, we need to sensitize our medical professionals also in emergency, which we did. and and time is precious in time is very crucial in heat stroke cases. So we don't miss the time. We have sensitized the medical staff and the ambulance staff also. The If we are able to identify a patient of heat stroke, the treatment should start from that point itself. So in our ambulances, which bring the patients to our hospitals, we have upgraded them to have a facility for the treatment of heat stroke patients. So we have kept a one box, one ice box, which has a capacity of 20 to 30 kg ice, and we start cooling that patients even during the transport. And as per the guidelines also, the heat stroke patient should have their initial treatment started on the field itself. And the treatment is very simple, just that the
Mm-hmm.
people are there. The treatment is cooling as fast as we can cool. The same
Okay.
principle is done in during transport in ambulance and even after reaching the hospitals. So in our hospital, what we have done is we have we have two bathtubs which has a capacity of something like 150 to 250 liters. So we fill that bathtub with 150 to 200 liters of water. We add something like 50 to 60 kgs of ice into it, and we bring down the temperature of the cold water to 1 to 5 degrees centigrades. And that is the recommended temperature. And we immerse the patient, heat stroke patients, in that bathtub. We attach all the monitors, including ECG, SpO2, blood pressure, and two temperatures. And the temperature in heat stroke patient has to be core temperature. It's not the surface temperature. It's not that oral temperature, auxiliary temperature. It has to be rectal temperatures, which denotes the core body temperature. And the target is to bring down the temperature as early as possible, something near 100 to 101 degrees centigrade. After immersing the patient into that bathtub, we after 20 to 25 minutes, we are able to achieve the temperatures of target temperatures of 100 and 105. And this fast cooling is so effective that we saw the patient who came unconscious due to the heat stroke actually regained consciousness within 15 minutes of immersion cooling.
Okay,
So
it's that effective.
it is that effective. So this is the fastest way of cooling the uh, patient. So
Mhm.
and this is the standard treatment for heat stroke patients.
Okay.
Once that is done, we take out their patients and send this such patient to ICU or ward, depending on their patient's conditions. But large majority of these patients actually go into ICUs because such patients actually come very late to the hospitals. Most of the patients who are diagnosed as heat stroke patients come unconscious. They lose their ability to sweat, and their hemodynamics are compromised, their sugar levels are compromised, their electrolytes are imbalanced, and by the time they come to the hospitals, they also develop multi-organ failures, kidney AKI, acute kidney injuries, yeah, acute renal failure is one of the most common things. It's
Okay.
something like we can correlate with egg proteins. Like egg is basically a protein. If we boil it, it get hardens and dysfunctional. Our body is also made up of proteins. So with
Mhm.
such a high temperature of 510 degree Fahrenheit, our proteins get denatured, and
Okay.
because of denaturing, our enzymes don't work, and
Mhm.
which leads to the multi-organ failures, which affect kidney, lungs, brain, all those organs. So the more we delay, the more multi-organ failures develops, and the chances of mortality also increases.
Yeah. Again, very useful advice there. To Dr. Neeraj, I have an extension of what I asked Dr. Yadav. Because we now know that there is a vulnerable group, probably, which is more vulnerable to heat related disorders as compared to others. So, which are these people, which are these population groups, and also what they can do in order to prevent this from happening and going to a stage where we need, immediate medical care.
So I will say there are two type of vulnerable group. One because of their physiological status, one group, and one group that is because of the nature of their work. So if we talk about the physiological group, vulnerable group that include the kids, children who simply don't listen to what we say and play in sun, or when they are in school they don't drink water properly and play in hot in high temperature, then they we consider a very vulnerable group because of their physiological status and their age. And then of course other extreme and elderly people who anyway with progressive age lose their ability to control their body temperature. It's a normal physiological process. So they may not sweat. The classical sign of the sweating, excessive sweating, they may not manifest in those type of elderly patients as well. And those patients, like I said, who have comorbidities, say a patient who is hypertensive, a patient who has chronic kidney disease, a patient who is a heart patient, because all these heat related changes which happens in our body, the physiological changes, the hemodynamic changes that happens, that is more easily manifested in these type of vulnerable group. So extreme of phases, those with comorbidities, they are vulnerable because of their condition. And then there are a group of people who work in hot and humid conditions, say a farmer who has to work in heat, a traffic policeman who has to work in heat, a construction worker who has to work in heat. So these people are again very vulnerable. So awareness program about heat stroke and the heat related illness and how to prevent that, these are the population where we have to actively involve. I'm sure sir will agree that majority of patients which he might have seen belong to one of these two groups, either because of the nature of the work or because of their vulnerability. So, simple steps like spreading awareness to stay hydrated, to work during the cooler period of time, what type of dress they are wearing while working, taking adequate breaks in between, providing a cool environment, at least when they are resting, at least they can take time in those cooler environments so that they can adjust their body. So these are simple steps which can be targeted in these vulnerable population, and that will go a long way in reducing morbidity and mortality to heat related illness because of
Yeah,
it.
yeah, absolutely. Dr. Yadav, again, a question to you. Since you see a lot of these patients, like Dr. Neeraj mentioned, most of these people who come to land up in emergency department are those who have been working for long hours in the sun directly sometimes. Also, sometimes when the night temperature is also very high and there is no respite, they don't have access to, maybe coolers or ACs, are the ones who fall sick very severely because of heat. So what, how can we actually make, how practical do you think is it to make our workplaces also, especially for these vulnerable people, vendors, people, farmers who are working outside, or others who are on the street and are taking the most impact of the sun for preventing heat related deaths? Can you suggest some measures that can be taken to probably
So,
reduce?
we can have a targeted approach. We should
Right.
focus. We should focus on those on that population which is vulnerable, and the vulnerable population which I served last year is the workers who are working on the construction sites during the
Mm,
summertime, the security guards, the security guards who are standing in directly under the sun, the elderly who get neglected at home and were placed at the top floor and asked by the family, "We'll take care of you," and light goes away, and they are brought early in the they are brought in unconscious state on the next day that the elderly was found to be unconscious. A large majority of this population belongs to a low socio-economic status. A very commonly the people working on the roads by the roadside, वो रेहड़ी पटरी पे काम करने वाले लोग, they were the sufferers. So if we approach them as a targeted population, then we can definitely bring it down to a much lower level by giving them education, by giving them information, and sharing the ways out how we can avoid. So creating awareness in the form of uh, the times to be avoided, what all they should wear, what kind of food they should take, uh, proactively hydrating themselves, identifying how to identify the symptoms, uh, what to do at their level in the field initially when they are suspecting, and telling them that once these symptoms are there, don't wait at home, bring them the the affected person to the hospital. So these are the things: uh, wearing simple cotton clothes, cooling when the temperature is very high, hydrating well, hydrating in the form of simple water, Nibu Pani, ORS, Panna, all those liquid form of things, and doing it proactively. That's the main thing. So these are the certain small things which are actually all about awareness, creating an awareness about the possible disease.
yeah.
So these are the things which can definitely bring down the mortality and incidence of heat stroke and heat related illnesses.
Yeah, so important message there is to prevent it from happening and prevent the crisis before it actually strikes people. Dr. Neeraj, one last question, quick question on what do you think? Because as you mentioned earlier, there is electrolyte loss from the body, which also is responsible for many of the issues, heat-related issues that happen. Many a times people pick the wrong kind of electrolyte in the market. Sometimes they are just sugary drinks. So which are the kind of drinks and other measures, apart from other measures, do you suggest for people to be careful about in order to protect themselves?
So again, one of the challenges we face during summers is that people, especially children, I'm more concerned about children because they are the most impressionable age. If we inculcate right habit, then when they grow as adult, they will be more learned. So the sugary drink, the fizzy drink, the carbonated drinks, which they feel ki it's going to hydrate them, it's going to help them fight this electrolyte imbalance. Actually, these are sugary drinks, and in fact, they dehydrate them more. So if you take a cold drink, you can yourself feel that for some time you'll feel ki, okay, the thirst is gone, but after some time you'll again become more thirsty. So that these drinks actually dehydrate. So we should encourage people, especially those without comorbidity. I'm talking about normal, healthy person. They should be taking balanced electrolyte drinks, say ORS. If you are losing a lot of sweat, then of course ORS is a good way to rehydrate. If not, you can use a simple shikanji which you make at home. Even that can hydrate you properly. You can take fruits like watermelon. That again, that's a very hydrating type of food. Avoid hot drinks like say tea and coffee, especially during warmer time of the day, because that again that will raise your body temperature and that can affect your thermoregulation. An important thing about those with comorbidities, especially say a kidney disease patient or a hypertensive patient, what type of drink they should be taking, they have to consult their respective doctors, because the general dictum may not apply to them because we have to restrict salt in them. Kidney patients have a restricted type amount of fluid they can take, so they have to basically optimize their uh, what type of drink and how much fluid they can take based on the recommendation of their doctor, based on what stage of disease they are, what medications they are taking. So, general dictum for normal population: avoid fizzy drinks. Take ORS where whenever you feel dehydrated, or you can take shikanji, or you can take hydrating fruits like say watermelon, or which will make you keep you healthy during these hot times.
Yeah. So the message here is also to pay attention to nutrition, go for the right kind of nutrition and go for the right kind of things. Also talk to the doctors when it's required. With this, we come to the end of this very important discussion. Really appreciate both of you joining us. Thank you so much, Dr. Neeraj and Dr. Yadav. Really appreciate that you could make it for the conversation today. Thank you so much.
Thank you. Thank you.
Thank you.